More than a third of adults in the United States are considered obese, and many struggle to lose weight naturally. Well, pop singer Carnie Wilson underwent weight loss surgery more than a decade ago, and just recently she had surgery for a second time. We're going to talk to her in just a moment, but first, her story.
I am morbidly obese. I am so obese to the fact that I could die.
For years, pop singer Carnie Wilson waged a very public battle with her weight. Starting from a young age, Wilson found that her addiction to food was more powerful than she was.
I know that it will always be a battle.
By the age of 31, the 5'3" Wilson tipped the scales at more than 300 pounds.
Weighing 300 pounds is deadly for anybody. And if you're 5'3", it can be very deadly.
In 1999, after years of struggling, Wilson made the difficult decision to undergo gastric bypass surgery, a decision she went public with, broadcasting it over the internet. She saw incredible results, shedding half of her body weight, 150 pounds, and in 2003, 4 years after the surgery, the singer showed off her new body in the pages of Playboy magazine. But over the years, Wilson's weight fluctuated and her battle of the bulge continued, something she again went public with. This time she appeared on VH1's Celebrity Fit Club.
What the hell did I get into?
As the mother of 2 girls, she says that pregnancy derailed her weight loss efforts and contributed to her ballooning again to over 200 pounds. Last year, she got a very public wake-up call from TV host Dr. Oz.
The blood sugar's 100, so you're borderline diabetic again.
I'm borderline diabetic right now.
Yeah. How you feeling?
Shocked.
Wilson knew she needed to take action. In January, 12 years after gastric bypass surgery reduced the size of her stomach to that of an egg, Wilson made the rare decision to undergo a second weight loss procedure, this time lap band surgery.
A lap band is a surgical procedure where an inflatable plastic device is placed around the stomach. It constricts the stomach and makes it into a very small pouch, about the size of an egg, down from the size of an eggplant.
Wilson is now a spokesperson for the procedure, compensated by Allergan.
Something has to be done. The scale hasn't moved in 2 years for me.
A decision she broke publicly to her bandmates on their new reality show, Wilson Phillips, Still Holding On.
I am going to have another type of weight loss surgery.
Experts say surgery is only a weight loss tool, not a magic bullet, and that diet and exercise continue to play an important part in a patient's success. A slimmer Wilson is determined to keep the weight off this time around, and she's already more than 30 pounds lighter.
I know this pain.
She showed off an already healthier, fitter figure in the 2011 hit comedy Bridesmaids, another step on her very public journey. So Carnie Wilson is with us now, along with NBC's chief medical editor, Dr. Nancy Snyder. Good morning to both of you.
Hi.
First of all, very brave. Here you're so public, as always, trying to help other people. So here you are sitting here.
That's the
trying
point.
That's exactly the point. So you gained, what, 2/3 of the weight that you had lost after these pregnancies that you had. So what made you and your doctor decide, we got to do this again, we got to have weight loss surgery again?
Yeah, you know, I didn't know that that was an option for me. I was at the point where I did need intervention. I didn't see the scale move for 2 years, and medically, I mean, I'm 44 years old. I'll be 44 this month. It's almost 13 years after the first surgery, and I needed to take action. I needed to help myself again. And I'm not ashamed to talk about this in public. It seems there's been so much support over the years, and it's still interesting to people because so many people relate.
It's Nancy, 79%, according to a recent study, of patients who underwent gastric bypass surgery reported some weight gain. So why is that?
Well, in some is okay, but when you compress the stomach and you sort of reroute the circuitry, the hope is that you'll eat less. But as Carnie will tell you, that's a big psychological mountain for a lot of women because we have love-hate relationships with food.
Right.
You have to really consume calories intelligently, and it requires a lot of emotional support.
So you're talking about, then, really a commitment and support that allow a person...
life change.
So what do you want to
Total
talk
life
about?
change.
What do you want to say about that?
I mean, this is all very important stuff. The message isn't, you know, go out and get a surgery today. It is an option for people, okay? But for me, this is about all the years... What I've been through in the last years has taught me a lot. I've learned I've got to take care of my health. This is about health. It's not about what I look like, what the scale says. It's about my lifestyle.
Well, and as a pre-diabetic, we know from some pretty recent research that surgery and lap band can help change glucose levels even in the hours after surgery. So as a borderline diabetic,
right,
her worst fear is to suddenly become a full-blown diabetic with all the complications that follow.
I was borderline diabetic, and for me, what I feel now, what is the difference this time? I feel the sensation of being full quickly, which I was not feeling. So I have that tool, but I can't tell you the changes I've made, the changes what I do every single day, what I put in my mouth. I'm not eating sugar. I'm not eating flour.
See, I suspect you're approaching this as more of an adult this time, mother of two, very differently psychological mindset than you did during your first surgery.
Yes, and I'm teaching my children, these are the habits. These are habits that I'm laying the groundwork for myself, for my future. For the right reasons.
So what is your message then to anyone listening who's considering these kinds of surgeries and, in terms of how you think they should think about the actual impact of this surgery, what it can do and what it can't do?
Right. We're all individuals. The most important thing I think we need to remember is that we're all a work in progress. We're not perfect. Do not be ashamed or be afraid to ask for help. That's what this was for me. I asked for help. We need to help ourselves, but we need support, like you said, total support.
And the surgery isn't first line, but once you have diabetes and you're morbidly obese and you've tried other things, we know the surgery is safe. We know the outcomes are really pretty darn good. Mm-hmm. But it's not the first line treatment. It's the treatment that saves a life.
Mm-hmm. Well, good luck to you in this effort, because I know it looks like you've launched a massive effort to continue this weight loss.
I'm so proud. Thank you.
Well, thank you for being here. We're going to hear you sing in a little bit. We're excited about that. I listened to that CD you've just made, and I love it. We're going to hear you perform with the rest of Wilson Phillips.